Dr. David Lloyd. How do you respond to that very strong argument from Professor Dalgleish?
A very strong, unscientific argument, I'm afraid. The evidence is overwhelming that if you give booster vaccines against COVID, you prevent serious illness and death, and that's what we're in this business of. I think the professor says that it doesn't do an awful lot for getting the illness. I've had COVID twice, as well as being triple vaccinated. But the key thing is to avoid people dying and going onto ventilators. It is a big problem. Do you know how many people died of COVID last week?
But I'm not at risk of dying from COVID.
Why not? You're male. You're slightly overweight.
And my age?
Are you 30? But honestly, everybody thinks that, yes, you're at risk of dying from COVID only if you're very old or very frail. That's much more
I'm statistically not at risk of dying from COVID, having had it 3 times.
We are all at risk of dying of COVID.
I must refute those claims. It is absolutely ridiculous to claim that the virus protects you of getting very ill and going to hospital. The wonderful studies done in South Africa show that Omicron is much more infectious, but it's much less likely to put you in hospital.
It is a much less deadly virus.
Okay, don't both talk over each other. I'll let you respond, David, in just a second.
Last week. And we're in the middle of the mildest Omicron wave at the moment. That's not going to be the same come this winter. We are going to get many, many millions more infections. And who knows what the next strain is going to be. Each time we vaccinate, we provide a little protection. Even the Wuhan vaccine gives you a little bit of protection against Omicron. But as you know, we are going to be the first country in the world to give the bivalent vaccine. So we are protecting against both the Wuhan variant and the Omicron. So we are trying our best to keep this country safe, not only...
Well, the vaccine hasn't done a very good job, to be honest.
And to protect our NHS. We have the lowest number of ICU beds of any country in Europe, or when we used to be in Europe, and now we're stupidly on our own. And we are desperate to protect those ICU beds. 200 people are still on ventilators, or were on ventilators last week. Who knows what it's going to be in the middle of the winter? So anybody that says don't get a vaccine is saying don't protect the NHS, don't protect those who are most at risk from getting ill, don't protect those who are most at risk of dying. It is foolish propaganda to say don't get vaccinated.
Well, I think you are spouting quite a lot of propaganda, actually, because you're not looking at people's individual circumstances about whether they would be at risk from dying from COVID, whereas there are risks connected with the COVID vaccine.
There are so few contraindications to the virus. It causes such few problems that we should all get vaccinated without question.
Okay, well, tell that to the person who lost their leg, tell that to the person who lost their dad. Nina Mishkov, you want to come in?
Yes, I certainly do, because I'm staggered that scientific people and medicine as a science should be speaking like this, and surely this is a personal view as opposed to the view of the World Health Organization
or the died of COVID last week?
Do you respect, for instance, the Lancet? Well, the Lancet has stated that the vaccine has saved nearly 19 million lives around the world. The government statistics have shown that over 100,000 people have been saved by the vaccine. And I have
Nina,
had
do you trust the World Health Organization? Because you just mentioned that.
I trust that. Well, I'm asking if a doctor trusts the Lancet. Do Imperial College London? They have the same statistics. You can't rubbish every scientific or medical establishment.
So you want the booster, Nina, on a personal level?
I have had 4 jabs, and I'm also happen to be taking part in a Public Health England survey of antibodies. So for 18 months, I have given blood before and after my boosters and at various times in between. So I can see, and I'm happy for people to see the actual thing, how my antibodies have gone up from, I don't know what the actual measurement is, from 2,255 before I had my 3rd dose to 17,000 in January, so that's 3 months later. So they do work, and while they do work, why should we not take advantage of them? And especially with winter coming up, absolutely ridiculous to listen to someone whose personal views are not scientific and rather arrogant.
Well, Nina, do you accept that perfectly healthy folk have died as a result of the vaccine?
I have no idea of the statistics, but of course, any treatment is going to cause risks. But the
surely it should be a personal choice, one that is based on personal risk
profile. The percentage of people who have had adverse reaction to that is minimal compared to the millions.
But
and
Nina,
what about long COVID?
So is the risk of those people dying of COVID. But look, I want to bring in Dr. Steve James, who has been sitting there very patiently. Nina, just hold fire, because I want to bring in Dr. Steve James, who's been sitting there very patiently. Now, Steve, you were, of course, prepared to lose your job as a consultant anaesthetist in the NHS, not to take the vaccine. So you're in a very different place to Dr. David Lloyd and to Nina. So how would you respond to what they're saying, Steve? Because they're saying that your approach is irresponsible.
Dan, I've been working on intensive care since the beginning of the corona crisis, and the patients who are there with COVID now are not dying from COVID. They have got COVID. It's an incidental infection. I have not seen, and I don't know anyone else who's seen people with pure COVID pneumonitis, maybe one case in the last 6 or 8 months in intensive cares, and I've been working in 3 or 4 different locations in the country. So it's not a big problem at the moment on the intensive care units. Now, what's important to say is, are people who are healthy, is there any evidence, let's take someone like yourself, Dan, is there any evidence from a randomized controlled trial that using a booster is going to reduce the mortality? Can we inform someone like Dan that if he takes the booster, this is the outcome? If he doesn't take the booster, that's the outcome?
Government statistics state that you are twice as likely to not get long COVID if you have a vaccination.
Long COVID? Oh,
long.
goodness.